सर मुझे 4-5 दिन से थोड़ा-सा ज़ुकाम है और 2-3 दिन से ऐसा मुझे लग रहा है कि मुझे सीने में बहुत दर्द है। क्या ये हार्ट अटैक की निशानी है?
ओके। सो ये ऐसे केसेस अभी हमारे पास बहुत आ रहे हैं। वी इनकाउंटर अ लॉट ऑफ सच केसेस राइट नाउ, स्पेसिफिकली इन दिस वेदर, जहाँ पे सर्दी, खांसी, जुकाम, थोड़ा घणो बॉडी एक थाय. So there are a lot of cases which we see right now. So usually they are viral infections, and the complaint which you are telling me right now is most probably or more often than not a viral infection. But the problem right now we are facing is whenever someone gets a chest pain, they point out with one finger, okay, this is the point where it is paining, or this is the point where it is paining, and they get very scared and paranoid. Now this is a heart attack, and if I don't do anything, I will die. So please try and understand that out of 10 people complaining of chest pain, 6 will not be a cardiac origin chest pain. So there are non-cardiac causes of chest pain also. So please don't directly rush to the conclusion that this is a heart attack, I need to go to a cath lab and I need to get a graphiplasty or any other treatment done. It may very well be a non-cardiac origin chest pain. So let me take this opportunity to educate you slightly regarding that. So let's say you have viral infections like cough, cold, some runny nose, some body ache, and it also leads to a lot of coughing repeatedly. So what happens, your ribs, which are not bony constantly throughout, so they are attached to the center chest bone through some cartilages. Those attachment points, the moment you cough and you expand your chest, you cough, you expand your chest, so what happens, those movement points become tender. So sometimes they develop some sort of a swelling, and that is what we call costochondritis. So that is one of the most common reasons for chest pain in periviral scenarios. I'm not saying that you should only think, this is costochondritis, this is definitely not a cardiac chest pain. No. But you should also not worry too much that this is always going to be a cardiac origin chest pain. So the best thing to do is go to your family physician and tell him in detail what is happening with you. One idea which I would give you at this point is call him up from your phone and try and say your history or whatever you are facing, either you or someone close to you who's seen you. They are talking to the physician and they tell the history in detail, and by the time you reach the hospital, the doctor already knows what is wrong with you. So that can also save you time in case it turns out to be a suspected cardiac chest pain. But in case it is not a cardiac chest pain, it is important that you go to a family physician and not a specific single organ doctor. Because what will happen, the cardiologist, I'm not saying they don't know other things, but they are more inclined to think of cardiac causes. A gastroenterologist is more inclined to think of peptic ulcer, gastric ulcer, and other gastric causes. But your general family physician will at least rule out ominous causes and then will guide you in the direction which needs to be done. So in such cases, other non-cardiac causes are important to be ruled out. Let's discuss about another non-cardiac cause, which is the most important one, which we say acidity थई छे और इसको acidity हो रहा है या पित्त हो रहा है, something like that. So yes, gastric acid reflux or a gastric peptic ulcer disease is one of the most important differentials of a heart attack. Sometimes cardiac chest pain presents as a peptic ulcer pain, and a peptic ulcer pain seems to be a cardiac chest pain. Yes, they both can present with the same way, and every epigastric or central chest pain needs to be ruled out for either scenarios. But again, if such scenarios are pointing towards non-cardiac origin, so they need not be neglected. And let me tell you one more thing, in today's day and age, as we are becoming house animals, so we are developing lesser and lesser exposure to the sun. So vitamin D deficiency is another very quintessential part of everyone's day-to-day life. If you see vitamin D levels in 10 people, 9 of them would be deficient, including me. So what happens is sometimes vitamin D deficiency is enough to trigger a costochondritis attack, which is much more aggravated and serious than a normal one. So sometimes simple things like vitamin D supplementation and pain reduction medication or anti-swelling medication can be enough to rule out your pain. But yes, before we close this talk for today, every chest pain should be informed to a doctor. There is no two ways about it, that needs to be done. Let him or her rule out that this goes in the favor of a cardiac origin chest pain or a non-cardiac origin. But always remember, worrying is not going to get you anywhere. So don't always consider every chest pain to be a cardiac origin chest pain, specifically if you can localize it with one finger here or there or some other place. Usually a cardiac chest pain is very generalized, it is very severe, and it feels more like heaviness or tightness in chest rather than actual pain. So I hope today's discussion has thrown some light on a very controversial topic. Till we meet again, bye bye.
Thank you, sir.